Safety suture may help prevent serious complications in cases of extreme IOL subluxation, such as in this case. A plate optic is suspended by only a few zonals and may fall backwards into the vitreous cavity during any surgical maneuver. Therefore, the first procedure was to thread a 16 mm straight needle through the hole of the lens optic. The lens is now stabilized and vitrectomy can be safely performed. Scleral fixation is done by threading a second needle through the same hole and back through the sclera using a 27 gauge needle as a guide. Now, the safety needle can be removed. The same procedure is done on the opposite side by threading the needle through the hole at the base of the optic. The lens is now secured to the scleral wall and the knots are buried. In the second case, the IOL lies on the vitreous face. The needle is inserted through the paracentesis and is used to dig up the IOL optic. A zipser slip knot is now performed to secure the lens optic. Now, vitrectomy can be safely done without fear of lens dislocation into the vitreous cavity. The optic is now brought forward in front of the iris, and iris fixation is done in a regular manner. After the second pass of the needle, the safety suture can now be removed and iris fixation is completed. In the third case, one optic and the entire optic are located behind the posterior capsule. The lens is supported only by the adhesions of the anterior and posterior capsules. A safety suture is inserted utilizing the hole in the IOL optic. It is not always necessary to tie the suture. The IOL loop is carefully released from the adhesions and manipulated into the sulcus. The safety suture can now be removed. The posterior capsule is cut open and the lens is brought forward in front of the capsule and positioned in the sulcus. Iris fixation is done to ensure a stable lens position. In the next sequence, the entire lens is located behind the capsule and supported by only a localized fibrosis at the optic-optic junction. The optic is secured using the zipser slip knot technique. The free endings of the safety suture are seen on the right. After making a large incision in the posterior capsule, the optic is pulled forward, the lens, the sulcus, and the optics are sutured to the iris. In this case, the IOL completely dislocated posteriorly into the vitreous cavity. The hook is used to dig the IOL loop and hold it in the anterior chamber. A safety suture is now fashioned using the zipser slip knot technique. Pulling of the safety sutures may help capture the IOL optic in front of the iris. Anterior vitrectomy is now completed and the optics are sutured to the iris. In summary, safety suture can be of great help in some extreme cases of IOL subluxation.